With routine dental appointments suspended during lockdown, there has been some confusion over whether you can still be seen for urgent treatment.
Well, here to try and clear up some of the uncertainty is dentist Dr Monik Vasant. And good morning to you. Thank you very much indeed for joining us. So, I suppose we've got to ask, first of all, are the dentists still open?
Yeah, well, firstly, thanks very much for having me on this morning, guys. And Philip, I feel your pain about the KFC right now.
Coming from a dentist, that's amazing.
You know, we still got bellies. The problem has been that obviously this has caught everybody off guard, and maybe some of the advice was a little bit slow coming, but now it's all there, and people have got everything sort of set up. So most practices are operating an assessment and advice service, which means that, you know, if a patient has an issue, the first thing they can do is phone up their local clinic, and they've got dentists working tirelessly and members of staff working tirelessly behind the scenes, answering phone calls, triaging patients, and trying to manage the situation, possibly without the need for the patient to come in for an appointment. However, there have now been urgent dental care centre set up, so that if a patient has a genuine emergency and needs to be seen, the government is saying that these clinics are now operational. I think something like 200 of them are now operational. There has been some delays, I believe, in it when we look at organisations like the British Dental Association and the British Association of Private Dentists are saying that many of their dentists are calling them saying, you know, they've got nowhere to send their patients. But I think the biggest problem has been a lack of personal protective equipment, which hopefully now is getting sorted, because obviously everyone in the world is after it right now. Yeah. And the medics have got to take photos.
And so the biggest risk to you as a dentist is actually the aerosol production when drilling and spraying in a patient's mouth. Is that right?
Yeah, it's one of the highest risk professions in as regards to COVID, mainly because you're working in very close proximity to the mouth, and there are all sorts of droplets all over the place, and these can remain in the air for a while. Obviously, we're still learning more and more about this, and there's been talks about moving forward air filtration systems and much higher levels of personal protective equipment, which obviously are for the good of the patient and the teams working on them. So this is one of the reasons why dentistry has pretty much been stopped. It's not that dentists didn't want to work, it's because obviously, rightfully so, it needs, while we're still learning about this virus, it needs to be provided in a very careful sort of environment where utmost protection is adhered to.
So what about these, you're mentioning the hubs, the dental care hubs. Where do you find them? How do you know if you've got one in your area? And if there's one miles and miles away, how do you know if you've got a terrible toothache, where to go?
Yeah, Philip, it's a deeply frustrating situation for clinicians at the moment, because it's still a service that's kind of getting on the ground. The majority of big cities will have facilities. So, for example, in London, if a clinician feels that a patient has a genuine dental emergency, and we must stress these hubs are for genuine, serious dental emergencies, not for more minor things, which maybe still have an impact on a patient's life, but nevertheless, they're classed, some minor things like a lost crown and stuff aren't really factored in as genuine emergencies. And if a dentist thinks that a patient needs to be seen, then different areas have different pathways in place. So in London, people call 111, maybe they get some sort of PIN number by the dentist, and then the 111 guys triage them again. There's a vast amount of dentists who have volunteered for this 111 service, working tirelessly in the background. These guys are triaging patients and then booking them in to relevant clinics, where the urgent care clinics. In Manchester, patients have a dedicated phone number where they can ring the number, which relieves the 111 service of this problem, and they can access care directly there, which seems to be working well. The problem is in these rural areas and in areas where there's no urgent care centre, and we must, you know, as a profession, just plead the powers that be that they please need to get this set up as soon as possible, because patients are suffering, clinicians are sat there not sure what to do, and we want an end to these stories of patients taking matters into their own hands.
What about if it's not that serious and you want to go and maybe buy some medication yourself over the counter? What's the most effective?
Yeah, well, I've been thinking of a few things over the last couple of days that patients can do, and a few scenarios that could be quite useful. So, I mean, if somebody has a filling that's dropped out, obviously, in normal circumstances, in the normal non-COVID world, we would say, go to your practice, contact them immediately. Obviously, they're going to be limited in what they can do. But if it's a pain-free lost filling, maybe getting some temporary filling material, either from a local pharmacy or buying it online and just plugging it in the hole. It's like a putty. We did a service for some of our patients where we left it in a sealed pouch for them when they came to collect it outside. So some practices are offering this fantastic service. Others, maybe not be able to do that. So, but you can still, the patient should be able to get hold of this stuff. But that's really if there's no real pain, mild sensitivity from the loss filling. Excuse me. And if it's major sort of discomfort, then obviously we would not want patients to take that in their own hands. They need to contact their own clinics. Other things are lost crown kits. You can buy little lost crown cements that you can try and mix into a little paste, put in the crown and pop the crown on if the crown falls off. And there are things like this. Obviously, kids who are having braces, maybe a brace is pinged off or the wire shot, use the wax, the orthodontic wax, and push that around there. So there's a variety of situations which I'm happy to give you other scenarios if you like.
But what about painkillers? What if you have got a toothache? I can remember as a kid, my mum used to put oil of cloves.
Oh yeah, that's
on
so strong,
on our teeth. So what about painkillers? What should you buy from the chemist?
Yeah, absolutely. There's this misconception that you need, major centrally acting painkillers to cure toothache, and it's absolutely false. Really, the best thing is paracetamol, up to 1,000 milligrams 4 times a day, and ibuprofen as well, 200 milligrams 3 times a day. And you can alternate between the two. And we're not talking the posh ones. We're talking just plain basic ibuprofen and plain basic paracetamol. Obviously, with the caveat that you need to be your medical history needs to be fine to be able to take those things. But they are the best things that you can get for dental pain. But obviously, if it's serious, please contact. If they're not touching the sides, you need to contact a clinic.
And you actually think you had COVID-19, don't you?
Yeah, I mean, it was before the lockdown. I had a situation where I came into work on a Monday and got a call from a patient who had unfortunately been diagnosed with it as positive. And they said, just letting you know so that you know, because you might be carrying the symptoms now without knowing. And it was very odd. Within a day, I sort of developed symptoms. Thankfully, other than my dad bod, I'm fairly fit and well. So thank God I recovered pretty well. But yeah, it wasn't so pleasant, and you can see why it's having devastating effects on people, maybe with medical issues or certain conditions.
Well,
Thank you. Thank you for
talking
joining us
to us today, and let's hope it's not long before we can get back to a world where there's fried chicken.
Thank you very much for having me.
Take care, bye now.
A quick thanks to all our colleagues working on the front line.
Absolutely.
Yeah,
Yeah,
sure.
thank you to all of them. Thank you.